This is a long overdue update for the week beginning the 27th of June 2022. The theme of this update is prevention is better than cure. Too many times in the last few weeks, we've seen patients who are in the middle of a week off work due to severe influenza symptoms. Many had getting the flu vaccination on their to-do list, but just didn't get it done in time. For the whole of June, New South Wales Health has funded free influenza vaccine to the whole population. You don't need to be over 65 or under 5 or have a chronic condition. The epidemiologists correctly predicted that a severe and early influenza season would happen this year. It's happened early because we're all flu naive, having had almost no influenza circulating for the past 2 years, and the lessons learned from reducing COVID spread in the past 2 years also seem to have been forgotten by a lot of people. Perhaps an additional reason is that patients are potentially experiencing vaccine fatigue, being overwhelmed by keeping up with the rules about when boosters are due. If you haven't had the flu vaccine yet, please do book with our nurse Chelsea to get this done this week. Even if you've had influenza A already, the annual flu vaccine is still recommended because it contains 4 strains, including 2 influenza B strains, which may just be the flavour of the month in the last half of winter. With regards to COVID boosters, the guidelines have become quite complex. To make things really easy, ATAGI has published an algorithm which clearly lays out who's eligible for boosters and when. And we've posted this algorithm on our website, and our receptionists have a copy to refer to laminated on their desks. At Walker Street Doctors, we continue to mandate the use of masks, use telehealth as a preferred mode of consultation, encourage our staff and patients to stay at home when unwell, to socially distance, to open windows and use air circulators and air purifiers in our consulting rooms, and to screen patients for respiratory symptoms. This continues to be important now more than ever to protect you, our patients, and to protect our workforce so that we can continue to provide the highest quality of primary care for you. But there's a much bigger picture. When circulating cases of influenza and COVID increase, hospital admissions and ICU admissions also increase. There's a flow-on effect, so that if you're a 30-year-old who's got pancreatic cancer or a brain tumour that needs surgery and post-op ICU, your operation may well need to be deferred because there are no ICU beds available. If you need a hip replacement or endometriosis surgery or gallbladder surgery, well, those are the waiting lists that will really blow out. If you break your arm or cut a tendon in your hand chopping an avocado, the emergency room will be so full that you'll be waiting for hours. If you need an ambulance because you've gone into premature labour at home, or if you've suspected spinal injury on the football field, they may take some considerable time to get to you because they're ramped at the emergency department trying to unload their previous patient. That is the big picture, and that is happening all around the country as we speak. Is prevention better than cure? I'd say so. In other news, from this Friday, 1st of July, self-collected, MBS-funded cervical screening is available to all women aged 25 to 74 inclusive, not just those who are 2 years overdue. This is a red top swab, and we can talk you through the process very easily. The idea is to collect cells to be tested for HPV, and if low risk, this screening is done every 5 years. If high or intermediate risk, then there's an algorithm that we follow for management. Cervical screening is not recommended under the age of 25 unless symptoms are occurring, and this is to save a lot of unnecessary testing and treatment. You can keep having funded screening beyond the age of 74, but this becomes your choice and you'll fall off the National Reminder Registry. And I hope this update has been helpful.